Hi, I'm Dr. James Meschino. The question is, what causes high blood pressure? Now, there's two types of high blood pressure. There's essential hypertension, or essential high blood pressure, and then there's secondary hypertension, or secondary high blood pressure. Most high blood pressure is known as essential hypertension. That's about 95% of the cases. And it's not clearly understood why some people have high blood pressure and other people don't. But there are some factors that increase its expression that we know. So having a diet that's very high in salt, where your salt intake exceeds about 5.8 grams of sodium a day, if you're susceptible, often it'll trigger it. For some people, being overweight, it elevates their blood pressure, whereas other people who are overweight, their blood pressure doesn't rise. But it is a risk for people who are susceptible to it. Not being aerobically fit can also lead to an increased risk in blood pressure in people who are susceptible. So with essential hypertension, although we don't understand why it just occurs in some people, there are some lifestyle factors that seem to trigger it. Secondary hypertension, which is only about 5% of the cases, is caused by an underlying condition, usually in another organ or tissue in the body. So for instance, a tumor in the adrenal glands can lead to high blood pressure, or chronic kidney failure can lead to high blood pressure. But the World Health Organization has shown that 75% of people that have high blood pressure, it's in the mild to moderate range, and it's mostly essential hypertension, and it can actually be controlled best and safest by using dietary and lifestyle interventions. And so why are diet and lifestyle interventions the first thing that should be considered? Because we know that certain antihypertensive drugs that lower blood pressure, all have some side effects associated with them. And so doctors are told that they should be using diet and lifestyle measures first in those cases, but they sometimes forget to explain that to the patient. And so that's really where I come in. I want you to understand where the human clinical studies are that explain how best to lower blood pressure if it is rising and if it's just simple essential hypertension as most people have. So I want you to download the Lowering Blood Pressure Naturally program that's available here and start acting on the strategies right away if your blood pressure is high. These are the natural blood pressure lowering interventions, lifestyle interventions that have been proven in human clinical studies to be effective. So you know it's a no-nonsense approach. Now, MeschinoHealth.com, you'll see my other review papers. You'll see other articles that I've written, footage from my live seminars, other videos, downloads, other resources I created that are free that will help you lead a long, healthy, functional life. That's what we all want. Not just to have a heartbeat as we get older, but to have a healthy, functional body and mind for as long as possible. All my review papers and my teaching materials come complete with all the scientific references, so you know you're getting only evidence-based information that is solid, scientifically sound on any health topic that you might be searching. So be sure to use MeschinoHealth.com as an ongoing, reliable resource on health and wellness topics that are important for both you and your family members. Thanks so much for watching.